Hi, everyone. Looking forward to this amazing and exciting session that all of you all have written to us about. So, in a few minutes from now, I'll be ready to welcome somebody really special all the way from Australia who's going to tell us a little bit more about how we can do something that we've always been thinking about but haven't gotten around to doing it. Yes, I'm talking about making dentistry absolutely contactless when it comes to patient appointment bookings, patient scheduling, as well as creating a whole new experience for the patient today. What we are now calling the new normal. So, without further ado, let me introduce to you Dr. Adarsh Pisharodi, who was not only one of my mentors, but also a great friend. So, to tell you a little bit about his journey, I'd like to tell you that he migrated to Australia as one of the only few people who got selected. And this was about 11 years ago. And as he started his journey there, he is actually now the proud owner of a great practice, and which is right at the Sunshine Coast. I think it's a dream practice for most of us, boasting of one of the best equipments right from CEREC to CBCTs to like cutting edge latest practice in terms of dentistry. And I think we all would love a sneak peek into how he does dentistry in Australia. So we are going to have an interesting session, and I do hope you send us your questions and we will reply to you as soon as we can. So let me get him on screen now, and let's welcome him all. So hi, Dr. Adarsh.
Hi, Diksha. Just call me Adarsh. How are you?
Yes, it's been great to see you. And I think it's awesome that we reconnected in lockdown. And
That's
I'm
right.
good. I'm good. Just trying to catch up on all the things that are changing in dentistry.
I
So,
know.
looking forward to
You,
this
you've become one of those dental devas, haven't you?
session.
You're always on screen. Yeah, but thanks for having me over. Well, it's really good to connect with you like this. If we can't meet in person, I can't see when I'm going to fly back to India next. So it's going to be a long way away, I imagine.
I think the next part of the conversation has to be something that all of us can't ignore. I mean, everyone who I've spoken to, I am talking about how COVID has affected their part of the world. So,
Mm.
what was it like really for you in Australia?
Uh, Well, we went into not a complete lockdown, but partial lockdown about the same time as you guys did. So about the 23rd of March it was. I remember when we were told to that restrictions have been applied to our practices, and we got a bit lucky there. We got out really cheap because we came out much quicker. I believe you guys are still well. While I think the lockdown has kind of opened, but still the cases there peaking, we got really lucky. We came out much quicker. It was about 5 to 7 weeks. I remember we were restricted in our practice, never completely shut down. I actually came to work almost every day. The
Right.
number of cases in the Sunshine Coast really was not enough to bother any of us. And Australia in general, we're so far away from the rest of the world. We are so disconnected. Normally, that's a big challenge for us, but this time around it worked out in our favor. So we didn't have a lot of cases here, and so while it did touch us, it did not affect us greatly.
I understand. In fact, here the situation is that people are battling this disease, and while we have respected the norms of the lockdown and stayed safe in our homes, we are now going back to practice, and we are in a very responsible position here because any laxity on our part can cause us to really spread the infection instead of really controlling it or helping people out. So I think we are, in fact, because we've had this lockdown, we've had very stimulating discussions on how we can improve our practices, how we can probably incorporate some practices from the Western world to really optimize and get better. So I'm happy about that. And even though it has been a very challenging time for many dentists, including myself, both financially as well as mentally, it takes a toll when you've not gone to work for 3 months. But I think we've done well in learning more and
Mhm.
also sharing a lot of knowledge.
Sure.
Have there been any kind of changes like that since COVID-19? Like, what do you think is going to happen?
In terms of how we change our practice, oh, well, a lot has changed really. It's a bit like 9/11, you know, once we had the 9/11 attacks in America, you know how the whole airport security changed.
Correct.
19 years on, it's still it's not the same anymore. I think COVID will do exactly the same thing to us. A lot of things have changed and they will stay for a very long time. Simple things like contact, human contact, is going to decrease. Handshakes, I don't know if we're going to be able to shake hands with our friends anymore. It's just, yeah. You remember the famous video of the Prince of Wales adopting the Indian namaste instead of the handshakes. Wearing masks has become like normal now.
Yeah.
It's something completely that no one's seen in their lifetime, and for all you know, you might be wearing masks from here on in tight spaces like an airplane. We already see Asian countries adopting the face mask when they travel overseas. Maybe everybody has to do it now. Social distancing might become a norm. We might be 1.5 meters away from each other. Working online, I could never imagine working from home was a real thing, and now we know it's a real thing. In fact, COVID has taught us that a lot of jobs can be done from home. Really, a lot of people don't need to go to office anymore. So
Yeah,
all of
yeah,
that is going to change. Schooling online, it's incredible. The amount of changes, and some of that is going to, I believe, is going to stay for a long time. There's going to be more emphasis on digital, going online, and going contactless. This is the topic for our discussion today. I'll tell you a little bit more about what I mean by contactless, but essentially reducing human contact. Okay, because human contact
correct.
can eventually transmit diseases. So you want to try and keep that to the minimum. And I'll talk to you about some of the things that we have done now. We are now used to new words which we've never heard in our life. Pandemic, never used these words. Quarantine, triage. We know so much about PPE, which we never talked about before this. So just like all of this, I think contactless is going to become a new norm, and that's what I want to talk to you about. I want to talk to you about how, look, we really can't be contactless in dental profession. We need to be in and around our patients, but the aim is to try and restrict, uh, let's just say, unnecessary contact, not just for yourself, but for your staff members as well. So the patients feel safe as well. So they don't want unnecessary contact if they don't have to. So there's some things that you can implement in your practice that can help you do that. And that, I believe, is going to be the new normal.
Yeah, I see a lot of my friends working from home and, adapting so comfortably to this new way of working. But
Mhm.
for the entire dental industry or the dental profession is extremely, uncertain about how we are going to apply this to our, profession, because we are constantly in contact with patients and we can't really prescribe like we have for the last couple of months. We've just sort of survived by prescribing, but that's
Yeah.
not really our prime way of treating patients. And
Mhm.
a lot of my team members also live in far off places, and travel earlier was so convenient in Bombay. But
Mhm.
I think the new reality is that we're working with smaller teams, and maybe half of our teams are back at home, which
Yeah.
is why I think contactless or adapting that to our practice might
Mhm.
actually give them something new to learn and train on. So I'm
Mhm.
really excited to see what you have in store for us and actually adapting contactless to our profession. Colorful appointment schedules, which got really I got intrigued with that.
Yeah.
So if you could go back to that a little bit and tell me what that's about.
Essentially, what we do is, yeah, this is the advantage of having a practice management software. There's so much you can do. There were times when we've all used calendars, and calendars, like in their physical form, have a lot of you can't do so many things. This allows me to see my whole week in one glance. It allows me to see 2 weeks in one glance if I have to. It allows me to see my whole month if I wanted to.
That
Coming back to your question, the color coding is so each procedure in dentistry we have color coded so that we know what our day is going to look like. So if you look at all the yellows in there, they're related to crown preps or crown inserts. The red up there is an emergency appointment. These purples are fillings. The greens are, scales and cleans. Uh, the light green ones are just consults or reviews. So essentially,
wow.
what happens? One look, and I know what my day is going to look like. Is it going to be a big day? Is it going to be an easy day? I can also go into my screen and have a look at what the other practitioners are doing on the same day. So this is a book for yesterday, Friday the 19th. So that's AP, that's me, that's Prachi's book, and that's a hygienist. So I can also have a look at, what kind of day it's going to be, what kind of staff I'm going to need, and just gives us a clear idea of what's going on. It just helps us, that color coding just helps us know what's going on.
That's super. I think we have priorities like this, but I think the color coding feature would be really good. In
Hmm.
fact, what I'm seeing is your yellows are most likely in the first half. What does that mean? Like, and your greens look like they're more in the second half. So, is there some sort of triage that you follow? Is there some sort of method to this?
So it's great you noticed that because I have tried to implement this system in my practice just to make my life a little bit easier. I'm just going to go 6 months ahead in my schedule to show you what these are called pre-blocking. I think they're called. They call it a word. So essentially, what you're doing is can you see my screen there? This is my screen for the
Oh,
future, right? 21st of December 2020.
nice.
What I've really done is I've given my receptionist or the person who books my appointments a reasonable guide to what I want to do and what I want my day to look like. So here, if I just hover around the orange, it tells you surgical. So I'd like to do, look, I'm a morning person, so I like to do all my, difficult stuff in the morning and try to ease
What
through work through the day. So surgical would mean implants or any wisdom teeth, all of that I want to do first in the morning. Go down to my yellows and I want to do like a crown and bridge. That also requires a lot of focus. Go down to the blue and there's endodontics. If I need root canals, once again, I want to try and do them in the first part of the day rather than at 5 p.m. when I'm fully exhausted. And then
got
you
it.
go down to slightly less taxing appointments. This is for fillings. So the blue means fillings. The fillings are easier. So once you go to the second part of the day, you can do slightly easier appointments. And then you go to the greens, which are scale and cleans, which really, the easiest things you can do in dentistry. And then down there, you can see it's just for cons. So consultations, someone wants to come and just have, or just my orthodontic appointments where I just don't have to spend a lot of time or energy. So what this does for me is that I start off my day doing the more productive or the more taxing jobs and I ease through the day. Now, this is just a guide for my receptionist.
Right.
So essentially, my ideal appointment. So what I want to do now is probably go back to what I would consider an ideal day, and I'm just going back in my diary to 2016. I kind of think okay. So if
You
you
know
look at
what
this,
makes
this is
me
my
think of?
sorry.
Actually, sorry to interrupt you, but this really gives me a great idea, especially from the COVID point of view, that we are following all these intense, infection control procedures in these times, especially for treatments which are maybe aerosol generating. So,
Right.
we sit in those PPs all day and we can't even go to the restroom. We can't even eat. It's
Yep.
quite intense. So,
Yep.
I was coming through some schools of thought which are saying that you can ease up a little bit. But I think what you're suggesting is amazing because we can do a combination of both, where we can actually slot our aerosol procedures in the morning,
Which is first thing in the day. That's right.
and then we
And
can
then
take
and then
part of
you
our
can open up your windows and let that aerosol settle down, and then you can do
exact
your other procedures like scaling. But look, this is what my ideal week would want to look like, where I'm doing lots of implants and crowns, of course,
Yeah.
and and then you're trying to do all the high intensity work first thing in the morning, and then if
Right.
you go down, you can see it goes down to the light greens and the greens, which means that's the easier thing. That is what gives me the energy to go back home and play with my 6-year-old daughter. But if I was doing a root canal in an upper seven at 5 p.m., I'd be dead by the time I get home. So this is
I,
another thing. Look, you can use it in whatever way you like. Now, this actually suits me. So I like my day where I'm doing, the big jobs in the morning and I
yeah,
ease off to the afternoon. You can, like you said, it's your choice. It's your appointment book. If you try and pre-schedule these into your diary, like I did here, what
right.
you're doing is you're giving your receptionist an idea of what you want your ideal day to look like. It'll never work like that. So if you look at my appointment book last week, I have I have a crown insert here, which is
Right.
not ideal, but it's
You
just a guide.
got to do. Right. I completely understand where you're coming from.
So
In
I will do a root canal at 6 p.m.
if you
You
have
know, if I had to, but
exactly
once again, just giving this little idea to my, I'll stop sharing now. Just giving that little idea to my receptionist it goes a long way, because then they know that I'll give you an example. Patient call says, "Oh, I know I need a root canal. I need an appointment at 6 p.m." Your receptionist will say, "Oh, okay. Can you do like morning instead of 6 p.m.?" And they're like, "No, I'm too busy. I want a 6 p.m. appointment." The receptionist says, "I can give you a 6 p.m. luck. Just letting you know, Adarsh likes, oh, sorry, they call me Adarsh here, but Adarsh likes to do appointments like root canals in the morning because he's more fresh at that point. And, at the end of the day, he's obviously not as fresh as he is in the morning. But I can still give you the 6 p.m. appointment." Suddenly the patient's like, "Oh, wait a minute. I don't want him to do a root canal when he's tired,
I
and
know,
I'm
right?
play- and I'm only playing tennis at 11 a.m. Let me swap tennis for the day, and let me
Right.
do the root canal at 8." So just putting it to them. So if you ask them, when do you want an appointment, it's like you're opening up your life to him. You don't
Right.
really want to do that. You want to say, "Oh, look, I can give you a 6 p.m. appointment, but like I prefer to do it at this time. That's what suits me." Patient might say, "No, doc, I really can't do 11 a.m. I have to do 6 p.m." That's fine. Look, but
Yeah.
what you're doing is there'll be 80% of the people who are working for themselves and have the flexibility. They appear to not have be flexible, but they do have the flexibility. And then just putting it to them, you'll be surprised at how many people who I thought can't come any
Actually, and
anytime.
I
Yeah,
think more so because of work from home, which is like something where they schedule their own day now. And I think
implant
yeah,
implant surgery, you want to do that first thing in the morning, because your room has to be fumigated. You go through all those processes. You don't want to be doing it in the middle of the day. If you ask the patient, when do you want an appointment, he's going to pick 2 p.m. What are you going to do? So you have to put it to them and say, "Look, this is the procedure. This is what time we like to do it. uh, if you can accommodate, it'll be good." And I'm telling you, there'll be 80% of people who say, "Yeah, I can do it."
which is amazing. And like we did a live a couple of days back where we spoke about how aerosol generating procedures can be absolutely done now, and we can
Yeah.
slowly go back to normal ways of
Yeah.
practice. When
Yeah.
I opened a couple of days back, I realized that patients are not really, they don't know how much we need to do to keep them safe. So if we're
Mhm.
able to tell them in this fashion of like in the morning there's better sterilization, better infection control, by the
Mhm.
evening if we're wearing PPs for over 6 hours, we can't be performing the same level of procedures. So I
Yeah.
think they'll get it, and this is a fabulous idea for us to start implementing. Maybe 3 months ago it would be absolutely like a utopia to achieve, but I think it's very doable now.
I'll tell you what, when I started doing it, in my head, I was like, "This is not going to work." Look,
Yeah.
you can't tell the patient that I want to do your procedure at this time. It's just not going to work. But
Right.
you'll be surprised at how much
I know.
patients are actually flexible, and they want you to do the best job, and they will.
with that, we could actually step into the entire contactless experience that we were talking about. I think everyone's really excited to hear about that. So any light that you could throw on
Yeah,
that?
yeah, sure. So COVID happened, and straight away, everyone was everyone's life has changed. Practice management softwares and systems are being developed to make sure that the transmission of, disease or spread of disease is restricted as much as possible. And I have actually accepted that yes, this is a change that we're going to have to deal with for the rest of our life maybe, and we have to change the way we practice based on circumstances. And now what we are trying to do is try and reduce unnecessary human contact, which means, if there's more human contact, more handshakes, more people in a waiting room, there's more chances of transmission of disease. How do we do that? Now, there are a lot of things that I've just introduced into my practice recently in the last 3 months. I'm going to share a couple of them with you. Whether One of the things that has changed in the last 3 months is teledentistry. Telemedicine already existed. Teledentistry is now coming. It's actually a billable item now in our whole Australian services that we provide. In fact, during the peak of the pandemic, I had a teledentistry appointment. Now, uh, these appointments have to be booked online. So this is when you're sitting at home, right? You can't practice. I don't know if you all can practice at the moment, but let's say 1 month ago, you weren't allowed to go, right? You had a boy who broke his tooth and he doesn't know what to do. How are they going to come and see you? Uh, in India, I think there is a practice of sharing mobile numbers. We don't over here. So how is the patient going to get in touch? They can either go to the hospital or they can book an appointment online. And I'm coming to that very soon. But I had a situation where a young child, a 3-year-old, uh,
Right.
fell, fell off the trampoline, avulsed his baby tooth. Mom is frantic, doesn't know what to do. Uh, Mom booked an online appointment through my diary, left their details. I gave them a call and asked them what happened. Uh, the mom explained what's happened. I asked them to send me a photo of the avulsed tooth and the mouth. It was a primary tooth. Avulsion in primary teeth don't require any treatment. So I knew that, don't worry about it. If they don't know, they can try and put that tooth back into the socket, because a lot of people put it in milk and bring it back. If you had an avulsed tooth in a 7-year-old or an 8-year-old and it was a front tooth, I then think it is a permanent tooth. Then I would guide them on what to do. So teledentistry is something that
Is
can
a
help. It can help us. Now we've got the technology to do it as well. Something where we can reduce human to human contact. You can give people advice over the phone,
right.
and that's something that I've trialed and it's worked reasonably well. The other thing that I have implemented is online appointments. Now this is the big thing, and this is one of the bigger things in contactless, because up till now the patient. So let's take your example. What are the ways the patient can contact you? Let's say a new patient wants to come into your practice. You've got a big board or a sign outside your practice they must have seen. There's a number there, they give you a call. That's probably one way they can contact you to make an appointment. I know in India you have a lot of walk-ins, so they can see your board and say, oh, all right, I need a filling, let's go in there. You really don't want that, because in this situation where you don't know the patient, you really don't want him to be coming to your office. What if he's got something that you don't want?
Correct.
This is where online appointment, and you can't do online appointment without having a website. So this is what I said, going online for dentists. If you haven't gone online yet, this is the time, because you need to be present on the web, so they have more ways of communicating with you, and they have more ways to book an appointment with you. You must try and have a practice management system like I've got, so you can do more things and you can make this whole experience contactless. Just to make this a little bit interesting, Diksha, I had asked you to book an appointment with me online.
That
So
was really
let's,
interesting.
yeah,
So
let's do that.
explain
Yeah.
this process a little bit to the viewers. So, guys, as you know, we shared a post about teledentistry just a couple of days back. And that's how we are doing our teledentistry. In fact, Adarsh, what's happened is Zoom has really helped us to kind of stay
Mhm.
connected with our patients. And while some practices have been able to transition very easily into tele and video calling and things like that, many practices are still debating if they should go back to the traditional ways or adapt to the new. So for all those people, I would say what you're about to watch now is going to absolutely change your perspective, and you would want to, as fast as possible, shift from a manual to an actual digital experience for your patients, because that's what they will be expecting from you.
Yeah.
If we start now, and we have many good softwares that are supporting us, so what I would like to tell them is that it's very much doable in India.
So we booked an appointment in my book for the 9th of July. So
The viewers, I would want to tell you that what he means by booking an online appointment is a bit different from what we do here, because here, while our patients can reach us online, it's not detailed to the extent that these guys are doing it.
we did this thing where I made you go onto my website and book an appointment for yourself on the 9th of July, and you
Right.
chose the appointment time at 1 o'clock. Now, this is what I get to see on my screen. So my receptionist will be able to see there's a new appointment there.
Correct.
New patients always have a little star. That's how the patient knows there's a new appointment. My receptionist knows there's a new appointment. There's your name there, and you can see that little red Wi-Fi sign there. That
Right.
is a sign to tell my receptionist and my staff that this is an online booking. When
Got
I
it.
hover around that appointment, it also gives me all your details and what
Got it.
you've booked this appointment for. So why I'm excited about this is it just gives the patient another way to book an appointment for themselves at their convenience, and it is stopping patients from walking into your practice, which is what you
Agreed.
eventually want, right? You want everything to be contactless, which means you don't even want the patient to be calling your receptionist. It's your time, it's your receptionist time. They can book themselves in. It just makes the thing a lot more automated, and there's a lot more you can do with this as well. So if I may proceed, what we do next is that I am now able to get into your file and automatically see a lot of things that you've entered for me. So I can see your name, I can see your date of birth. Can you see my screen now?
Absolutely.
I can see your address. I can see all your numbers. I've got your email address. I know that this is an online appointment. I know what you do. So I've got all that information already. And now what I can do is I can hover onto this tab, which is called onboarding this patient with forms. So now I can actually click each one of these and have all your details, or rather all your information emailed to you, so you can fill all the information that we generally do in the reception. So what's the normal process? The patient comes into the reception, you give them a medical questionnaire, they fill it out, there's contact, there's exchange of pens, there's all of that. So we're avoiding all of that altogether. All
Right.
the information about you is going to be online, and you're going to provide it by just simple drop down box. So
What
this is an email that you have got, and
Right.
I have just sent you a link to all the forms I want you to fill.
This is how they appear on email, and I think that's sort of a sneak peek. And
I sent you a medical history form, and you can see here that I've already got the information that I need
super.
as far as your medical history is concerned. I can also see some other information. I can see your emergency contact. Uh,
Right.
so I'm going to just double click your medical history form, and this is all that you've ticked. So you've ticked with anything the dentist needs to know. You've had braces in the past. You said you've had dengue fever. You said you got low blood pressure. All of that is now recorded into my system. Yeah.
Got it.
Uh, if I wanted, and I was really pedantic about it, I can actually double click this icon and print out this form. Now, the other thing is there is a little bit of concern about the legality of an online medical history as compared to
Right.
something that you do in the office. I don't know how it works. in India, but over here, digital signatures are accepted.
Super.
But worst case scenario, you can just print out this page and get the patient to sign again, or
Exactly.
or update this if you wanted to. But essentially, we are trying to go contactless, and this is a great way to get all the information that I need before your appointment, even before you come in. So I think online appointment booking is a great tool to just give your patient that next option to make an appointment at their own convenience, at the same time without having to pick up the phone and call you and give you so much information, even before you start.
Yeah, and it saves a lot of time for both parties involved. And I
Yep.
think everybody appreciates the effort and the smoothness of the entire experience. So I
Yeah,
think it's
and it makes you look more modern as well, It makes you look up to date, and patients really like that. The new generation, I don't know, have we reached Gen Z? Well, we were till Gen Y. They like all this stuff. They completely appreciate the technology and the use of technology for all of these things. So I'm actually quite happy with this online appointment thing. I think sooner. I've just implemented it a couple of months ago, but I'm pretty sure more and more people will become aware of it and they will try and book their appointments themselves. Yeah,
you
sure.
have a digital practice completely now. We talk about the digital workflow in
Yeah,
dentistry. I
yeah.
think it's so important to precede that with a digital workflow with appointments, because
Mm.
you can't be calling yourself a digital practice till you have these kind of systems in place as well. So I think that's a great value add.
Yeah, which is why I said this COVID is a good time for us to implement these systems now and get up to date, because this is the future. This is what we'll be in a few years. You know how everyone has got to adapt to the situation, and the sooner you do it, it makes you look a little bit better, if anything else. So I've already shown you online appointments. So the other thing is contactless is your medical history forms. We've gone through that as well. If you don't, you will also realize that when you book that appointment in, you got a little QR code. Now, this is about automatic check-ins. Okay. Now, let's just say the patient has made an appointment to see you at 1 o'clock.
Okay.
Let's just say, we are getting into an automated practice, and you don't have a receptionist in your reception area. All the patient has to do is you have a little iPad sitting on your reception desk, where the patient just taps this QR code onto that iPad, and automatically on my screen it shows that you have arrived.
Oh
So
wow.
I know on my appointment screen, I'm going to share the screen again with you. Tell me if I'm doing it right. Can you see that?
Yes, I can.
Yeah. So what will happen is once you check in, that little box gets ticked.
Nice.
And when you arrive, I can't do that now because it's a future appointment. It just shows that little tick in the box that you have arrived to the waiting room, and I might be in my surgery, and I might have this appointment book open, and I know already that you're here. So that's another way to reduce contact between the patient and your staff.
Right. Right.
You can not only book your appointments online, you can not only avoid the whole process of going through your medical histories and consents and all of that, you can
Yeah.
also check yourself in
Right.
to your medical appointment without even having to speak with anybody, which I think is a great
In
thing.
fact, it's amazing that you bring this up, because we've been telling our patients to call us from the car or once they're down,
That's right.
so
That
they
is
don't
right.
reach the infection control protocol. So I think if they can just
Mhm.
press the button and check in, so we
Yep.
know they're in. That's superb. And in fact, there are like a serious shortage of staff. So if you can
Mhm.
actually create an experience where we can reduce the number of people in the office,
Mhm.
again, a big value add for COVID.
Once again, it makes you look modern. It makes you look that you're keeping up with the times.
Right.
Uh, The other thing, obviously, that which is quite common here is payments. Contactless payments, and it's already there. You don't need to even operating your machine, the one that swipes your cards and credit cards.
Right.
People are going to touch it, and there's always going to be all those issues with infection control and transmission of
Right.
disease. contactless is the way to go.
Correct.
The implications are that you don't have to transfer currency, and that way increase your risk of transmitting. There's, while we are at it, there's another thing that I generally do in my appointment book, which I won't go back to my appointment, but that's called pre-booking. Pre-booking is really important.
Oh, really?
Pre-booking is really important. What I mean by pre-booking is that my receptionist will not let a patient leave the office if possible without another appointment. Now,
Nice.
if the patient needs, 10 fillings, they will book at least the next appointment, date and time fixed in the book.
Got it.
Uh, and if the patient wants to change the appointment, they can most definitely give us a call and change the appointment. Or I'll when we get on to the next part, I'll talk to you about online bookings and all of that. They can book themselves in at the time that they want, and that's all a part of this contactless dentistry I'm talking about. But
Right.
pre-booking is really important, because pre-booking is the only way you can make sure that your patients return back to you when you want them to, and not when they want to see you.
Okay.
There is, if you finish all the appointments with me and you've got all your treatment work done, today is the 20th of June. I will put you in the book 6 months from now. Nobody knows what you're doing in 6 months, and I don't know what I'm doing in 6 months. But just being in the book means that you will get an email 2 weeks before your appointment that you have an appointment made. Okay, I would have forgotten it, they would have forgotten, but at least that gives them the idea that, oh, okay, I need to go and see the dentist. If you don't have that pre-book, they will come back to you only when they have the next problem.
Exactly. I heard this word diary zoning from
Yeah.
Dr. Anish Chitnis in the UK, and he always explains that what gets slotted actually gets done. So it's interesting that we all in different parts of the world are discussing the same thing. That
Mhm.
if we don't pre-book or slot our patients, we can't hold them responsible for the neglect and the things that pile up in terms of their dental care. So I think
Yep.
another invaluable point, and also I think that opens up the whole contactless experience, because this time around the patient is not really coming in or walking in. They're
Yep.
actually, they already booked, so we know, what to do next. So
That's
I
right.
think,
He's already in the book, so there's no reason for him to call the practice. It's already there. If he has an emergency before that, yes, he can book himself in or give the practice a call. But just being there, very important when you're doing, for example, you're a prosthodontist, you do implant dentistry, right? So you take baseline readings of your implants, you measure bleeding, bleeding on probing, you measure your pocket depths, and you need to check it every 6 months to know. There's no point you place the implants today, 6 years later, patient comes back to you, the implants are not looked after and they're loose, and then you kind of feel guilty that, oh, it's my fault. Honestly speaking, if you don't pre-book them for their 6 monthly, you can't take the blame for what has happened. It's a two-way street. So pre-bookings are really important. It also makes you busier, which means that every patient that walks into your practice already has another appointment. And you'll be surprised when the appointment in the book, once it's booked in, you will have an 80% success rate with that, rather than, okay, all treatment over, we'll see you in 6 months. A verbal, we'll see you in 6 months, never works.
and that's exactly what we take patients from our practice. They have no reason to come back to us. Then they see they probably have lost our contact details or something of that sort, and that connection is lost. So I think that's another big thing that people in India are afraid of now, that we're going to lose patients. Practice is not going to be the same financially or from a business point of view. But I think that's another good suggestion for us to implement. So I
Once again, pre-booking. We talked about pre-booking some time ago. That is essentially making your practice contactless, because essentially no one has to pick up the phone. The
yeah,
patient already has an appointment in the book, and he gets an automated email 2 weeks in, 2 weeks out of the appointment. If he can't make it, he just sends you an email back saying, oh, and now the patient has the ability to go online and make a booking, make another booking. So once again, you're reducing the need for interaction, and that's another way you can go contactless. Well, we some of the practices here have taken it a step further. They've installed automatic doors now, so people don't have to touch on doorknobs, because that's one of the ways you can transmit disease. They've got this big transparent screen sitting in front of the receptionist, so there's no splatter from talking and all of those things. So a lot of these things have been implemented at different levels. And I think that is the future, because like I said, I I think shaking hands and that kind of greeting is going to be a thing of the past. People are going to be a little bit scared after this whole COVID era is gone, and it's going to change the way human interactions are. And the sooner you start implementing these processes, the easier it'll be for you in the future to run your practice in a completely automated way. And what's the future? We can take this so much further. I can almost envision the day when artificial intelligence and robotic dentistry, they're already talking about it. Think about the possibilities in the future. Patient can book an appointment online. Patient can check in over the phone. Doesn't need to talk to a receptionist. I'm sitting in my little cabin where I know what procedure needs to be done. My robot comes in, takes the patient into the chair, does a perfect procedure. Robotic medicine is already here. All
Right.
eye surgeries are done robotically. Oncology is robotic. I can't see that we are very far away from a robot taking over and doing your root canal for you better than you. And you're sitting, in your cabin just operating. It's already here in dentistry. How about CAD CAM? How good is CAD CAM? You scan the patient, you design the crown, you press a button, and there you go. You got a machine that mills the crown that fits perfectly. I mean, how far away are we from incorporating that into daily practice? And when that day arrives, we can be completely contactless. And I'll be looking forward to that day where you wouldn't have to touch the patient at all, and the procedure will be done start to finish contactless. Can you see that? I can definitely see that happening.
I think that will be an amazing future to envision. I think it
Mm,
makes some people scared about, what's going to happen to them. But I think that's the next level of
I just
increasing
think so.
production, of actually increasing efficiency in our practices. And we should look
Mhm,
at it as an opportunity rather than a threat. That if we want to do the better things, then we will
mhm.
have to automate to the best way possible. And I think
Yeah.
contactless is something that's a boon, a miracle, a mantra that you've given us today, and
Mhm.
so many great ideas that you've shared with us. I think everyone who's watched this or is going to be watching this over the next few days and weeks is going to thank you and remember you for all these amazing path-breaking ideas that you have shared with us today. So thank you so much for spending all this time with us. And we do look forward to seeing you for many more such informative seminars, just like the good old college days.
Thank you for having me, Diksha. It was an absolute pleasure. I haven't done this in a long time, and I was really, really anxious about this whole thing. I've never talked to a computer screen before, and this is the first time I'm doing it. And I was quite used to speaking in public when I was teaching, but for the
Yeah.
last 11 years, I've been so out of touch. So I was just keeping my fingers crossed, hoping this goes well. I really hope. Uh, I've been able to share a little bit of information. I hope that anyone watching this seminar is able to use. I don't want you to use everything. Try and use as much as you can. You know your situation better than me. There are no hard and fast rules here. It's just a stepping stone. It's just one of those things that we may have to start doing just to get ourselves in a better place. Keep everyone safe. That's really important. And then yeah, who knows? We'll be doing bigger and better things very soon.
Sounds superb, and look forward to having you with us again very soon.
Thank you.
So much.
Bye.
Bye. So, to summarize for all of you, I think we've got a wealth of information today. We started with talking about infection control practices. We even went on to talking about online consults, pre-booking. We have actually shown you 5 simple steps to make your entire practice contactless and your patient experience absolutely touch-free as far as possible. So we started with speaking about scheduling our diary better, zoning it in a priority fashion of infection control so that we can even change out of our PPEs. We even spoke about tele-dentistry, booking online, but with complete details, which means filling up even medical history forms, even consent forms, all in a matter of 7 to 8 minutes, and then making even payments absolutely online. And lastly, even the checkout procedures of having patients book in their next few appointments with us, so that we continue to build our practice and continue to have a loyal fan following of our patients who believe in futuristic dentistry and who believe in COVID safe practices, just the way we all are hoping to adapt in the near future. So thank you for spending this time with us, and hope this was an informative session for all of you.